While millions of Kenyans have registered under SHA, a close examination of the numbers reveal a deep crisis. SHA has enrolled 19.4 million members, yet only 3.3 million actively contribute. The rest rely on government subsidies or do not pay at all, creating a funding shortfall that threatens healthcare service delivery.
Is that things are not working the way they were intended to work. And our members are on the ground in communities providing services, and they can see what's happening. Citizens aren't able to get the services. So definitely, it's clear that something is not working.
According to stakeholders, if contributions do not increase, SHA will not be financially sustainable. This is because the indigent population must be fully funded by the government, or the systems end up collapsing totally. Kenyans have also raised concerns over increased premiums compared to the defunct NHIF, in addition to little capitation and payment of services by the medical cover.
Hospitali iko juu. Labda kama laki moja, laki mbili. SHA wanakulipia kama, for example, kama ni laki wanakulipia like 10,000. Hasa hiyo bili nyingine ya 90,000 wao mwenyewe uingie mfukoni. So it's not really helpful.
Tungependa kujua serikali inachukua jukumu gani kuwasaidia maasla kama watu wa jua kali.
Adding to SHA's woes is an inherited debt of 30.9 billion Kenya shillings from the defunct NHIF. SHA CEO Robert Ngasira appeared before Parliament, acknowledging the financial crisis, calling for urgent intervention.
Claims management.
Health Cabinet Secretary Deborah Barasa has also faced tough questions summoned by the Parliamentary Health Committee to account for the failing system.
Together with the Social Health Authority team, is having routine meetings to see how we can have a payment plan for their NHIF debt. We are engaging Treasury, we are engaging various MDs that were involved, for the bill to ensure that there is payment of that. So our engagement is ongoing. But
recent meetings between the Ministry of Health and the healthcare stakeholders have offered little progress, with the government requesting an additional year to clear outstanding debts owed to healthcare facilities.
We have patients behind hospitals who cannot wait for 1 year. We have nurses, doctors, pharmaceutical suppliers, landlords who cannot wait for 1 year. So our appeal for immediate settlement is an appeal on behalf of the entire ecosystem that is behind the hospitals.
On February 24th this year, private and faith-based hospitals withdrew from offering services covered by SHA due to delayed payments amounting to over 30 billion Kenya shillings.
Kwa hizi private hospitals wamekataa mambo na SHA, na hospitali nyingi ambazo ziko kwa mtaa ni private hospitals. So tungeomba kwamba serikali ishirikiane na private hospitals ili tupate huduma katika hizi private hospitals. Manake sisi kufika mpaka Makadara huwa ni kazi ngumu sana.
The government has since pleaded for patience, but the private sector remains skeptical.
Another one is to restore our health systems. Turudishe mpango wa matibabu. Wewe mwenyewe ndio umeharibu. Bila kutoa wewe hatuwezi rudisha.
Your administration brought a system that even yourself don't seem to understand. Hii kitu inaitwa SHA, SHI, SHO, SHU. Who understands this thing?
SHA's struggles are further compounded by the suspension of USAID funding, which has disrupted key programs targeting HIV, tuberculosis and malaria. In response, the government has announced plans to integrate these programs into the main healthcare system, placing further strain on the already burdened Social Health Insurance Fund, SHIF.
So it is still our appeal that government needs to find proper financing for healthcare. You've seen what has happened with the donor support pulling out. It's really unfortunate that today, as a middle-income country, and this is what we've been discussing here this morning, that Kenya as a middle-income country still funds half of its healthcare budget from external support.
Beyond financial woes, SHA is grappling with technical failures. Patients often report frequent system glitches, making it impossible to access medical care.
Inaitwa Jaramogi Odinga Odinga Teaching and Referral. Ukienda hapo unaambiwa SHA ifanyi. Paka uingizwe kwa wodi. Labda umeenda na malaria. Malaria lazima uweke kwa wodi.
Anaenda kwa hospitali, anaambiwa hiyo SHA yake haifanyi, na hiyo SHA analipa kila mwezi.
Frustration has boiled over into mass protest, with patients storming Afya House early this year, demanding urgent reforms. The challenges facing SHA paints a grim picture of Kenya's healthcare future, with funding gaps, system failures, and growing frustration, urgent reforms are needed to keep universal health coverage on track. Eunice Somolo, K24 TV, Nairobi.